right. Hey, it's Facebook Live time. I haven't done this in a long time, but I am really excited because I have, out of necessity, had to delve into all things coronavirus so I could best communicate to all of you out there just what you need to know. We are working very hard on facts, not fear, and sometimes that can be a delicate balance because this is, to some degree, an urgent situation where there's a lot of small common sense things we can all do, and we got to do them now, and if we come together, we're going to make a big, big difference for this country. But that's why we have experts here, and I'm so happy to have Dr. Andrew Lim from Bristol Hospital. He's the medical director for the emergency department there. It is not easy to get good medical professionals at this time because this is a critical time for a lot of the hospitals too. They've got a lot of preparing to do if this disease manages to spread as it is projected to spread. So I'm happy he's here to give you some facts and to give you some information to help you guys prepare on your own for whatever may or may not come your way, and also to help put your mind at ease, because I have found that if you find a little bit of anxiety rising, the best way to do that is to act, to do something, to not just sit there and worry about what could come down the road. And that's, I guess to a certain degree, I don't want to put words in your mouth, doctor, about being anxious, but when there's a lot that could be coming your way, you got to prepare, and that's what you guys are doing. So what Absolutely. Are you doing at Bristol Hospital?
Well, first, thanks for having me, Tim.
Yeah, pleasure.
But a lot of what you said, everything that you said was absolutely right. I mean, on a hospital level, we've been preparing for essentially the last 2 weeks with daily meetings, pulling in really every department within the hospital to figure out how can we accommodate our community, how can we accommodate our patients, and how can we continue providing great care while keeping our staff safe. So a lot of that is making sure that our staff has appropriate training with the use of personal protective equipment or PPE. So that's the masks and the gloves and the gowns. Yeah. The challenge with that is that, as everyone knows, there's a national shortage. Yeah. So how do we use that in the appropriate setting, and how do we preserve what we have? So there's been a lot of education and training about how to use that properly, but also how do we appropriately identify and test the patient who may be at risk? And how do we safely isolate that patient who may have a contagious infection so that we can treat them carefully and with compassion, but really ensure that we do our job and make sure that we don't spread that virus to others who may not have it. So there's been a lot of coordinated efforts between the physicians at the hospital, but also we take cues from the CDC, the World Health Organization, our colleagues at other institutions in the state and across the country, many of whom are already caring for patients with coronavirus or COVID. Yeah. So it's really been it's been a lot of efforts over the last 2 weeks, and I will say it's a moving target as well too. I know the CDC is doing a good job, but they can change their guidelines on a daily basis and sometimes an hourly basis. Yeah. So really, staying up to date on what's the best data out there, so we can practice best practices in the hospital, has been a challenge that we've met so far and plan to continue doing so.
And I want to talk a little more about that, but of course I just want to remind all of you out there that we are here for you. I've got enough questions to last a day and a half, but I want to know what your questions are out there. We've got Alana off on the sideline. She's going to be monitoring, so as soon as those questions come in, she's going to give them to me, and we're going to get them answered. I know a lot of them deal with comparisons that have been made to the flu, both for better and for worse, and we'll get to that in a second. But until we get more questions, and I just want to follow up a little bit more about these steps that you guys are taking. And how do you get around shortages of equipment? How do you get around shortages of potential shortages of beds, of just general capacity?
So that's a great question. So the first part is how do we get around the shortages of the personal protective equipment? So we have adequate stores. Yeah. But the biggest piece is education. So although it's tempting as a healthcare provider to come to work and wear the highest grade surgical or the highest grade filter, the highest grade mask that you can use, and walk around the halls and see every patient with that mask on, it's not necessary, and it's wasteful. And when we do that, we know for a fact that that's taking that resource away from another provider who may need it. So that's kind of an extreme situation, but really educating ourselves on the current guidelines of how we need to protect ourselves, and kind of using that appropriately is really key as well. The second question, your second question is kind of a much bigger challenge to us.
Yeah.
Right? How do we increase our capacity? Initially, the CDC has recommended what we call airborne precautions, which means that a patient needs to be placed in a negative pressure room.
Yeah.
That's a resource that across the country is rare. That's something that we typically reserve for patients with tuberculosis.
Yep.
So we've been working to use air filters to really turn rooms that have not been built for that reason, and convert them into negative pressure as well.
And to describe that, that's sort of a situation where the air is only going to move one way so that it can't be dispersed out with any pathogens.
Correct, correct. So all the air in the room would be circulated through a HEPA filter, filtered, and is then exhausted to the outside environment safely. But of course, the challenge is, how do we set up more rooms like that? How do we set up an area where staff can appropriately put on their protective gear before entering that room? But also anticipating a surge, how do we increase our bed capacity as well? So there's been a lot of great minds around the table in terms of planning, and a lot of things that will come online today and even this week to improve that.
Okay,
So
do we have any
our first
questions?
couple
What do we have?
questions,
Okay.
Elaine W. wants to understand, why is there a big run on toilet paper?
That's a wonderful question. Elaine W., if you couldn't hear Alana, wants to know, why was there a big run on toilet paper? That's almost more of a social psychology question. My understanding is that it can be a self-fulfilling cycle. I don't believe anybody in the media ever said go out and buy a bunch of toilet paper, but if it gets in people's heads that it's going to be a shortage, it creates its own shortage. People run out and buy toilet paper. But do you know any? I mean, have you seen something like that before?
Yeah, I completely agree. I mean, there's no medical recommendation to go out and buy toilet paper. I think we saw this happen with masks. I think we saw this happen with hand sanitizer.
Yes.
I think when, for lack of a better term, I think these fads can be kind of viral in a way.
Yes. Right, yeah, that's ironic, but completely appropriate in this case. Sometimes, it mirrors the contagion of an infectious disease. So, we don't really know, but I think the best guidance at this point is, I don't believe there's any long-term national shortage. I was just at a Stop and Shop yesterday, found that nice quilted Northern. I like my toilet paper good. I like it high quality. It's the finer things in life. There's plenty of it there, and if there's not where the store that you live nearby is, I imagine it would come back into stock sometime soon. So I don't think that's really a long-term problem in the whole scope of things. What else do we have?
Kara Wilson says, I have gamma globulin anemia. What can I do if I have IV treatments every 4 weeks? Will that help protect me?
Okay. Yes, gamma globulin, I believe. You said, what was it? Say the name? Anemia, yes. So she needs IV treatments every 4 weeks. Mm-hmm. I imagine the genesis of the question is, what happens if I'm not allowed to go to the hospital, or if I'm not allowed to leave my home?
Right. So that's a great question. We know that, especially in the immune compromised, the coronavirus is a lot can cause more harm than someone without a chronic medical condition. Right. So you definitely want to limit your exposure out in public. You want to limit your risk. What I would say is, I think many healthcare institutions, I can speak for Bristol Hospital, has really made a lot of effort to limit visitors, limit people who don't need to be there, to limit the spread, and really make efforts to make sure that our daily operations and caring for people with chronic medical conditions can continue on in a safe way. In a situation where if you believe that you may have symptoms or risk factors for coronavirus, that you may be infected, I would recommend contacting your doctor, because it's your primary care doctor that's going to help kind of guide you as to the specific treatments and specific alternatives. I can't talk specifically about your condition, but there may be alternatives out there that you can look into, whether receiving home treatments would be a possibility through the use of a visiting nurse. But you pose a very good question, and I would urge you to call your primary care doctor today.
And I'm sorry, what was her name?
That was from Kara Wilson.
Kara Wilson, thank you for writing in. If we did not answer your question in a satisfactory way, just write in again. We'll do the best we can. Do we have anything else right now?
A couple folks want to know, when will this slow down, and will warmer weather or spring weather help to kind of
Yes.
combat this?
Yes. When is it going to slow down? Will warmer weather kind of stem the tide like we see with the seasonal flu? That's a very interesting question, especially given that it's been unusually warm here in the United States, at least up in the Northeast. What do you think? I mean, that's something I feel like we did not know the answer to about 3 or 4 days ago, but boy, things change so quickly. Do we have any better of an idea?
So there are a lot of theories out there that because coronavirus acts like the seasonal flu, or even, coronavirus is actually, the virus itself, it's also actually the common cold. So because we know that it's likely to act like the flu and act like the common cold, there is the possibility that there is going to be the seasonal variation. So the good news is that there are a lot of experts out there that think that this may slow down with warmer weather. We have seen a slowdown across the world in places like China, whether that's due to the public health initiatives or due to the change in weather. I don't think we know for sure, but I think there's a lot of theories that think that this will slow down and improve with the summer months. I think in combination with the public health initiatives, I think we can slow this down. The flip side of that, from the good news, is that if this does behave like the flu, we could see a resurgence in the fall, and this could turn into a situation where we're talking about the cold, flu, and COVID season. But my hope is that with enough time, we can develop vaccines, we can develop specific antivirals, so by the time this next wave hits, we're more prepared as a medical community with more specific treatments.
Yeah, and it's so much to add to that too. I mean, people are asking the question, how come it's not spreading down in the southern hemisphere where it's summer right now? And they don't necessarily know that could be part of it. It's also 90% of the world's population lives north of the equator, so it just makes more sense. It's where the population centers are. Also, I thought I had read that the coronavirus doesn't really mutate terribly easily, especially when compared to the flu. Does that have any effect on whether it would be able to linger, either become endemic, where there's always a baseline level in the population, or whether we could stamp it right out with a vaccine?
Right. So if in fact it doesn't mutate as much as the flu, then you're right. I think the likelihood that it has that seasonal variation is going to be less. I think I have heard case reports that there unfortunately has been other strains of coronavirus found. I don't know how many different strains. I don't know. I don't think anyone knows how quickly it can change or mutate.
Okay.
But it's a lot of good questions, a lot of good theories out there right now.
And I'm also curious as to what kind of comparisons we can draw toward to other known coronavirus outbreaks, the ones that cause SARS.
Absolutely. Yeah.
And the ones that cause MERS, which doesn't get as much attention, Middle East Respiratory Syndrome. But I'm bringing that up because my understanding was that did manage to hang on despite warmer weather, and that there was a small but consistent amount of cases that I think may even still be going to this day.
Yeah. So SARS, or Middle Eastern Respiratory Syndrome. Yeah. So that's kind of interesting that you bring that up because molecularly, it's actually another coronavirus. So. The interesting stats that I've seen about SARS is that the mortality rate is actually 10%.
Yeah, which is huge.
Which is huge, right? And the mortality rate for coronavirus we now are thinking is less than 1%, which will mirror influenza. Yeah. Now, I think the reason I think that's interesting is because the challenge with coronavirus is that there's such a wide range of symptoms. So up to 80% can get better and stay at home and perhaps never get confirmation that they have it. Yeah. But I think because other viral outbreaks across the world have been lead to a more severe clinical presentation, I think as a community, as a medical community, we're quicker to contain that, right? So if people have more severe symptoms, the red flag goes up quicker. Yes. I think we're quicker to act on that. With the challenge with coronavirus is that it spreads so quickly because you can have asymptomatic carriers, you can have people who have the common cold. So the challenge is, identifying those people and,
Yeah.
and really getting them into quarantine.
Yeah, and I think my understanding is that while SARS might have been even more easily transmittable, when it was transmitted and it was deadlier, they were able to contain it because I think it was not contagious until a couple of days after symptoms started, which made a very big difference.
Right.
That's not known to be the case here with this current outbreak, and that is the devil's in the details with that one. And do we have any more questions? Because otherwise, at some point, I do want to start talking more about the flu.
Of course.
That seems to be a big source of questions and even some criticisms that we've been getting. But
We'll go to two more.
Yeah.
Kara Wilson actually did have a follow-up.
oh, good, Kara Wilson.
She
Yes.
wants to know, will her IV treatments help protect her?
So Kara is writing, and she's getting IV treatments every 4 weeks. She wants to know if they will help protect her.
I believe so. I think I think it would be great for you to continue treating your chronic illness, and I think it will. The more you can do to make sure that you stay healthy and you get a handle on your chronic medical condition, I think the less likely that you would be at risk for contracting coronavirus, but also the flu, but also pneumonia and many other contagious diseases. So I think you need to do what you can to make sure you're getting those treatments and staying on top of it.
I'm wondering how many people noticed I just put my hand in my mouth. The hangnail I was getting rid of. I did wash my hands before we started, though. Yes, people have been noticing that. And that's a good thing. We're telling people that we're trying to practice what we preach. And I accidentally shook a guest's hand the other day, and a viewer named Albert called me out, or Alan. I'm like, thank you, Alan. You do these things reflexively. It's okay if it winds up happening. It's just trying to change your habits. What else do we have?
When can residents see a vaccine? Do you
The
have
vaccine.
any details on that?
Yes. What do you think?
What I'm told is that a vaccine is probably on the order of a year to greater than a year out. The challenge is not only to make a vaccine that works, but to make sure that it's safe, right? So there'll be significant work behind the scenes to make sure that it's safe first on animals, to make sure it's safe with people. But then manufacturing of vaccines takes some time as well too. So I'm hopeful. I know that I'm sure there's many smart people behind the scenes that are working on a daily basis to develop it. But judging by past history, I imagine we're at least a year out.
Okay. Yeah, we'll just have to hang on, and hopefully, if it does become seasonal in a way, that might help. That's just going to buy us time. I think buying time is a very critical, important piece of understanding why this is the threat that it is. And to that end, yes, let's talk about the flu. When this first popped on the scene, I think the challenge for a lot of people, especially us in the media, was how do we present, how do we communicate what's going on here? And usually analogies are the best way to do that. And I thought early on, because people didn't know, is this a cancer? Is this like the Ebola virus? Is everyone going to die? A common sense analogy, albeit imperfect, was to look at the flu in terms of communicability. This has the potential to become very widespread like the flu. And so that served its usefulness. That being said, we are getting a preponderance of comments. A vast majority of them are saying, why are we focusing on the coronavirus? There are 2 confirmed cases in the whole state of Connecticut, 3 million plus people. Meanwhile, we've had about 65 people die. We've had 2,400 hospitalizations, and this is something that kills 30 to 60,000 people worldwide. Why are we not talking more about the flu? There's a disconnect here, and I get it.
Right.
I know how I would address it. How would you address that?
Yeah, so I think that's a good point. I think with the flu, we've been as a community, we are desensitized, right? So the flu has been around. We're used to hearing about it. Many of us have gotten it and gotten better. So I think we unfortunately have just become desensitized to the flu.
Yes.
I think one of our challenges on a hospital level is that we've really tightened up our visitor policy, right? So one of the questions that's been posed to me is, how are we going to ensure that people adhere to that visitor policy of, generally speaking, if you're not critical to the care of that patient, please don't come in if you don't need to. If you're sick, please don't come in. And it's really for your own safety. Now, my hope is that, with a lot of this coverage, that this is something new and in some regards unknown, that people will be able to adhere more to that kind of visitor policy. So you're right. The flu is more, especially in Connecticut and locally, it's much more prevalent, and it's caused much more health concerns and health issues for our residents.
So why not then just forget about the coronavirus?
Let's do that.
yeah, I know, really. And see, now this is where it gets tough. We are very focused on facts, not fear.
Mm-hmm.
But there are some facts that we've been sort of pushing down, and the reason why I want to get into them now is because people deserve to know, and I think it's hitting what might be a bit of a blind spot for the public as a whole. And I mean that with all due respect. People generally don't like doing math. Mm-hmm. And sometimes they have problem processing scale. For example, people know that a billion of something, like $1 billion, is 1,000 times more than a million. Academically, you know that. To be able to understand the difference between the two is hard for us to grasp.
Sure.
I think that also pertains to exponents, things that grow exponentially or can grow exponentially. And infectious diseases at least have that possibility.
Exactly.
That something that can start with one person, which every disease does, can eventually grow to infect 2 to 3 billion people or 50 to 60 million people if it's under the right conditions. Correct. So we don't know what we're dealing with. How quickly can the coronavirus spread in the United States if nothing else is done and we just let it do its thing?
Gotcha. I mean, so I don't know the exact answers to that, but I would take cues from what's happened across the world, right? So when this first happened in China, before they knew exactly what they're dealing with, it spread quite quickly. It spread to, I believe, tens of thousands of people.
About 87,000 eventually before they got it under control.
So I think we've had the luxury here in the United States of seeing what was done and what can happen with inaction, without taking appropriate public health policies.
Yeah.
I don't think we know as a medical community how the number of, on average, how much one infected person can spread to others.
The basic reproduction number.
Exactly.
Yes.
Exactly. But I think looking at the outbreaks in Westchester County, our neighbors in New York, we know that one person, in the right setting can infect many people.
Yeah.
So.
I'm sorry, not to cut you off.
Yeah.
Just to illustrate that, look at what Massachusetts is going through right now. It has about 90 either confirmed or presumptive cases. 70 of those 90 cases were tied to one meeting that a company had in Boston, Biogen. It was a company.
Right.
Well, I don't necessarily say there was any negligence. Maybe somebody didn't know that they had coronavirus. But ultimately, as they're tracing the lineage of those infections, 70 of the 90 got tied back to what was presumably, early on, one infection at one conference. Things really can spiral and snowball, and that just goes to show what you're talking about. What's at least on the table.
Exactly, and I do give a lot of credit to the governor in terms of really encouraging companies and across the state to really consider holding mass events and events where they're expected to be greater than 100 people. I think that's the right thing to do. No one likes to make last-minute cancellations when you've made plans, especially for social events and things that you look forward to. But I think in the current environment that we're in, it's the right thing to do.
You do. Yeah. And it does seem like the analogy I've been using is using a sledgehammer to kill a fly. It just seems disproportionate, but the other way to look at it is you can't wait for a disease to spread before you try to work on ways to stop the spread. You have to stop the spread before it spreads.
Exactly.
And if things can spiral out of control exponentially, the differences you make can compound. In terms of if one positive case of coronavirus can turn into 70 very quickly, I think it's reasonable to presume if you could stop one person from getting infected, you're stopping from that person infecting 2 or 3 others, and those 2 or 3 infecting 2 or 3 others. So the earlier you're able to act, the more magnitude those actions can have. I think I'm hoping that is helping to at least understand, regardless of whether you agree or disagree with any given move that the state is making, that's where the sentiment is coming from, that we need to act now before things get out of control. And they can, it's on the table, they can get out of control. That being said, these public health decisions are not made in a vacuum.
No.
There's consequences to them. We're seeing that in Cheshire. There were this morning a bunch of very angry high school students and their parents after they found out that the CIAC had canceled all winter sports tournaments. And in fact, the NESCAC, that is a college conference that includes Trinity and Wesleyan, just announced it's canceling all spring sports entirely. These are drastic measures. Does that surprise you at all?
In a way, no. I think, when you look at certain sports, obviously the level or the chance of spreading disease kind of varies by the sport, right?
Yeah.
You look at a sport like wrestling per se, where there's close contact and you're on the mats. Obviously that's a higher risk of transmission than something like baseball, where you can limit that, player to player contact.
Yeah.
I think, knowing that we're in a state that's surrounded, with cases of outbreak, multiple cases in New York and Rhode Island and Massachusetts, and so far we've, knock on wood, we've done a good job about limiting our cases in the state.
Yeah.
Obviously that can change. I don't think that's an overreaction. I think that's a good call.
Okay. Do we have questions?
We have a couple.
Yes. What do we
So
have?
we're saying facts, not fear, but
Facts,
the
not
truth is some people are concerned because of their health prior to the outbreak. And
Yes.
so reports are saying folks with underlying health issues are at risk of coronavirus. And
Yes.
so some people are wondering, can you give an idea of what those health issues are? Some people are concerned about having high blood pressure, maybe diabetes, being a dialysis patient, and many
Yes.
more. So can you give an idea of that?
So if you couldn't hear Alana, the question is, knowing that the CDC has labeled people over the age of 60 and people with underlying health conditions as being especially at risk for coronavirus, what constitutes the underlying health condition? I believe diabetes is one of them.
Correct.
I couldn't tell you exactly why. Yeah, what does it entail?
I think the highest risk patients are those with chronic respiratory issues, because this is a respiratory disease. Much like the flu, the patients who are at highest risk are those with COPD or chronic bronchitis, those with asthma. We know age plays a significant role as well.
Yes.
We know that, to my knowledge, I think there has been no deaths reported under the age of 9.
Yeah, I think that is still the case.
Right. So my son is 8, so I told him he's fine.
Yes. Well, there may have been one or two, because I did
Right.
see at least one study that I think had published the death rate at that age at about 0.02%, which would
Okay.
imply maybe there was one or two, but I'm not quite sure. Either way, the point stands that this
Right.
does not seem to be hitting children disproportionately hard like the flu sometimes can.
Exactly. I think, the best thing that you can do at this point is take care of yourself. Make sure that if you do have diabetes, make sure that your blood sugars have been under control, and make sure that you're being compliant with your medications. If you have high blood pressure, make sure that you're taking your blood pressure meds, and that you're keeping a log of checking your blood pressure on a regular basis, and that you keep your primary care doctor's appointments to make sure those things are in check. You got to take care of yourself. I know that there's a lot of advice of stay home and don't expose yourself to others, but it's still safe to go outside.
Yes,
Walking
you can
and
enjoy the sun.
exactly walking and
Yeah.
getting exercise and being in an open air environment, taking a walk down the street, making sure that you're getting fresh air. Not only is it good for your body, but it's good for your mind. It's a difficult time for all of us in Connecticut, and I think, in terms of anxiety and fear and stress, those are the things that we definitely need to keep doing, because taking a stroll down the street, as long as you're not around many other people, is still safe. We know that for a fact.
Yeah. So there you go. What else do we have?
Can you explain what social distancing is, and can it protect us? Can it buy us some time? Things like that.
Social distancing, that was the question. What is it? It's relatively new to the lexicon.
Mm-hmm. So I know in the healthcare setting, we've been instructed to try to maintain a distance of about 6 meters away from a patient who is suspected to have coronavirus. In the social setting, I think some of the biggest things that we can be doing as a community is, trying to avoid handshakes, trying to avoid kisses, avoid hugs. It's so difficult because it's built into it's just built into our natural habit, right?
Yeah.
So when you greet someone, to shake their hand, how are you? But you know, we all need to be the leaders in this. You know, you can you can bump elbows, or just say hello. You know, we all understand, you know, what we're up against, and I guarantee you will not offend anyone because we all know what we're dealing with.
And I have a little bit of social awkwardness where there's been a couple of times I've gone to shake somebody's hand and, oh, really, you can't do that. And then I thought about it for 7 hours. I made an ass of myself. You know, that's okay. Yeah, we just have to sort of change the way we do think about it. And proper hand washing and covering your mouth, I believe that's also considered as part of the whole idea of social distancing as well.
Of course, yeah. Making sure, you know, there's a lot of people have asked, you know, what kind of products do I need to buy to keep myself safe? You know, I think there's some pretty good data to show that simple hand washing with soap and water for 20 seconds is just as good as the alcohol-based, or maybe even better than the alcohol-based hand sanitizers. You know, I know there's a big run on that.
Yeah.
You know, and just making sure that, you know, if you do shake someone's hands, just make sure that, you know, you wash your hands, especially before you eat, right? So we kind of joked around about touching your face, but, you know, it's really kind of taking what's on your hand, you know, making sure that you don't take what's on your hand and getting it into your mouth or your nose or, up there.
It's all a numbers game. And before we talk more about that, you want a bit of good news. My understanding of just the nature of the coronavirus, not to get too technical, is that it's made up in such a way that soap itself, because of its ability to dissolve fats in grease, actually really does work especially well against coronaviruses. Normally soap works well because mechanically you're not killing dirt and germs, you're forcing them off of your hand. But in this case, have you heard something similar, that there's a sort of a lipid fat layer to the coronavirus cell that can be especially susceptible to soap?
That's kind of interesting. It makes sense. I haven't heard that specifically,
Okay.
but I would, you know, but it does make sense because a lot of the medical guidelines from the CDC in terms of caring for potentially contaminated sheets or things that a patient with coronavirus may have touched in the hospital, the recommendations are wash it in soap and water. There's nothing different. There's no special treatment to help prevent the spread on what we call fomites or you know, surfaces that may be infected. Just simple cleaning with soap and water. That's great. Which is good.
Help save the world just by washing your hands. They say 20 seconds, enough time to say happy birthday twice. Are there any times, you got to do it more often, but are there any times that are more beneficial than others to be washing your hands?
I think before eating is key.
Yeah.
You know, wash your hands, and that's what I tell my family as well too. You got to wash your hands before you eat. You know, because that's the time when you're going to be kind of bring your hand up to your mouth. You know, I think, you know, in a situation where you shake someone's hands, you know, I think it'd be good to, you know, wash your hands frequently. In the healthcare setting, you know, before we enter a patient's room, even regardless of, you know, if you think they have coronavirus or not, we should be, as a healthcare community, we should be washing our hands, or as we say, we should be foaming in, foaming out. Before the encounter, after the encounter, we need to be washing our hands. And a lot of this is not anything novel. It's not anything new. You know, this is something that has been kind of drilled into us from day one when you start the job. You know, so you know, we're talking about it, but it's these suggestions and these regulations they've been there. You know.
Yeah, and it sounds obvious, but I remember in the past, long before this whole scare started, that I did a story that I think a study found only about 7% of people wash their hands well, appropriately. A lot more than that wash them in some form. But that brings me to another point. I did another story about hand washing many years ago, where we put some sort of phosphorescent chemicals on my hands and had me wash them to see how well I did. I didn't do that well. I missed the outsides of my hands. I missed in between my fingers. So I can't believe I'm saying this. How do you wash your hands? Is there a particular sequence you go through to know that you're getting your hands cleaner than the average person?
Yeah, so I mean, I think the most important thing is the time. You know, is it 20 seconds? You know, I'm guilty of this as well. But you really have to make sure that you're spending an appropriate amount of time and really covering each surface. There's no magic about it, but you know, you bring up a good point that you really have to be conscious. You have to make a conscious effort about getting every surface in there and taking the time to wash your hands as well too.
What other questions do we have?
As of right now.
Okay, we're all right for right now. Yeah, just hop right in when you can. All right, so I want to talk more, even from a national perspective, about China's in Wuhan and Hubei province. The flu never really managed to completely collapse their healthcare system, but it did there. In northern China, in northern Italy, where there was another big outbreak, and we're seeing anecdotal reports of people saying, we thought, oh, it's just the flu, and that was our big mistake. And it collapsed their healthcare system completely. Why? What is going on? If this is just like the flu, we're hearing 80% of people are only getting mild to moderate symptoms. That has stayed stable. Where is the disconnect here?
Sure.
Why is the coronavirus doing this when the flu was not?
And that's a great question. I think it comes down to the fact that this is something new. There's no one has immunity to it. There's no vaccine. So I think the biggest part in that equation is the healthcare provider, right? So once the healthcare provider gets sick, you have to go home and quarantine, right? You can't safely care for patients once you have the virus. So then what happens, right? So there's been a lot of good policy making and about, we have to still take care of our staff. We still have to make sure that they're taken care of, at least financially. But who's going to step in, right?
Yeah.
So if you have multiple doctors, if you have multiple nurses who are out, what do you do in that situation? You're kind of left with a significantly less staff trying to potentially treat more patients. And there's no right answer about that. How do you do that? But I think the answer is in preparation and making sure that you keep the staff safe and you really try to limit exposure to your workforce to make sure that everyone can continue to work in a safe environment. But I think that probably plays a role as well, too, about the stress that it has in the healthcare system. And there's a lot of logistics around that we're trying to work through. I'll give an example. At Bristol Hospital, we're planning to increase our capacity, so that involves purchasing more negative pressure units. That involves setting up mobile units where we can safely test for coronavirus for people who may not be sick enough to come into the hospital, but that costs money, right? We need, we're sending the actual tests overnight to testing facilities that are off-site, because to my knowledge, no hospital has the ability to test on-site right now. I'm hopeful that changes, but that costs money as well too. And we're doing the right thing. We're investing in increasing the capacity, but at the end of the day, it costs money. I think from a federal level, I know that President Trump has put aside a significant amount of funds to help.
$8.2 billion.
Yeah, correct. But my hope and what needs to happen is that on a state level and on a local level, that money needs to trickle down to facilities and healthcare organizations like us at Bristol Hospital, where we are being proactive and committing the funds to be ready for what could be a significant stress on the healthcare system.
So we just got this news that the World Health Organization has officially declared COVID-19 a pandemic.
There you go. That was expected. If you didn't hear, Alana, the World Health Organization has now taken the step of declaring this a pandemic. That just means an epidemic that is spread sufficiently far, pan meaning wide, usually something that is considered worldwide at this point. That's not surprising.
Right? Yeah, it's news, but I think I think most everyone had that expectation that it would be declared that at some point.
Correct. It's in over 100 countries now. For a while, the number of cases that we are seeing each day, new cases, was starting to dip because China was getting a better hold on the coronavirus faster than it was spreading outside of China. Now that it's spread sufficiently outside of China, we are seeing rates, and this is just the concerning thing, again, to say why it's so important that we're washing our hands, is that it is doubling. The number of confirmed cases is doubling every 4 days. That's not just outside of China, that's within the United States. We're already over 1,000 cases, and I think we're at about 250 even 3 days ago. You don't need to be a math major to know that can spiral into millions within the span of weeks and just a couple of months, not 2 or 3 years. It can get very scary very quickly. Are you on social media much? Do you have time?
I am not.
Okay.
I am not, but
I wanted to mention something. There's a hashtag on Twitter going around called "Flatten the Curve."
Okay.
What this is a sort of an arm of the public awareness campaign to try to convince people that the reason why we're washing our hands and doing that is not necessarily because we can stop coronavirus in its tracks, but knowing that it's a pandemic and it's going to spread inevitably to some degree, we need to slow down the rate at which it does so to be able to give the healthcare systems time to catch up.
Yep.
In other words, you could have 3 million infections, but if they all happen, I'm just pulling 3 million out of nowhere. If you have 3 million infections within the span of a couple weeks worldwide, a lot more people will probably die from lack of access to medical care than if you had 3 million infections spread out over a couple months, because you're giving places like Bristol Hospital and hospitals around the world just time to catch their breath.
Exactly.
What do you think about that? Does that make sense to you?
Oh, it absolutely makes sense. I mean, we know for a fact that, you know, to think that we can contain this and eradicate it, it's not a reasonable expectation. So I think the expectation is that, you know, even with all of what we're doing on a public health scale and at the hospital, the expectation is that we can slow it down, you know, and we can slow it down to the point where we don't overwhelm the resources that we have.
Yeah, I mean, and we have not talked about it enough. China did that. China is a country of 1 billion people. It easily could have overtaken that country. They managed to stop it dead at about 87,000 cases. Granted, it's a little bit more of an authoritarian government there. They've got, they did some things that a lot of people here in the United States would quite rightly find morally questionable in terms of locking people down and surveilling them and giving them apps on their phone that would tell them when they're allowed to go outside. That's neither here nor there. We're not necessarily discussing methods. What we're trying to say is that both South Korea, using similar kind of containment measures, and China have been able to slow this, and in some cases even stop it. So there's a lot of reason to be positive. It wasn't even leading into a question that much, but just how, do you have any idea, sort of nationwide, statewide, just sort of what our hospital bed capacity is, what our ICU capacity is, and how filled it tends to be just on a regular given day during flu season?
Right. So, you know, that's a good question, and I believe it was yesterday or the day before when we had we held a press conference.
Yeah.
And we had the governor there and Senator Blumenthal. That was one of our asks, was to have, at least for the state of Connecticut, have some sort of way to have that information centrally. So if, for instance, a small community hospital is overwhelmed with caring for patients who have coronavirus, who can we call, that, on the state level that knows, okay, well, this other hospital actually has a few beds, why don't you send them there, and so to kind of work out those agreements and coordination of efforts. And I know I was told that is something that's in the works, that is something we're kind of looking into.
Good.
But as this evolves, that's something that on kind of multiple levels, multiple state agencies and national agencies are kind of compiling that information to find out where the resources are in that scenario.
Yeah, and of course, part and parcel of getting people in and out so that the healthcare centers can keep up with the demand is getting people better, getting people recovered. But we don't know a lot about how the coronavirus is presenting. We're learning more every day. What do we know now about how it presents, the length and course of the illness in people who recover that maybe we didn't know last week?
Yeah, I know from case reports in China, we do have an idea of the clinical presentation of the illness. We do know that the kind of what we call the prodromal phase, or the phase where you just don't really feel good, you might have low-grade fevers. We know that it can last for a few days. It can be actually a little bit extended, I believe, about 3 to 5 days. And the reason I bring that up is that it's in contrast to the flu, where the flu typically, it hits you hard, and it hits you hard at onset. We know that many of the symptoms are what we call upper respiratory nature, so fever, cough, congestion, and shortness of breath. we know that the patients who get sicker and come to the hospital tend to have a slightly different picture of their clinical presentation than someone with a typical pneumonia. Without going too much into medical details, when we get an X-ray and we see that you have pneumonia, we know for a fact that that looks different from the chest X-ray of someone who might have coronavirus. But you bring up a good point, is that there's a wide range of symptoms, and some people have the sniffles, have the cold from it. So the biggest message I think for the public is that if you're sick, but are not sick enough to be in the hospital setting, please reach out to your primary care doctor. And I think what we're looking at is, hopefully over the next few days and next few weeks, we can work out a system where if your doctor thinks that you need to be tested but you don't need to be hospitalized, we're going to have a system where patients can come basically for outpatient testing. That being said, we're not there yet, but our goal is that like you said, overwhelming the resources of a hospital, we want to continue caring for all of our patients. And heart attacks, strokes, opioid overdoses, that doesn't stop. They don't go on vacation. So we need to be available to care for our entire community regardless of what's going on. So we're kind of looking into how we can kind of care for that subset of population who wants to get tested. That's really the best advice out there, is use your primary care doctor as a kind of guide of where you need to go.
Yeah, that's what worries me in one way, but also provides us the greatest opportunity to improve, is that there is that prodromal phase where I'm guessing you're shedding the virus, you're contagious, but it's not really registering up here that this isn't a cold, because why would it? You just have the sniffles and maybe a low-grade fever. But now you're starting to see why the CDC, why a lot of places are saying, be prepared to stay at home for 2 or 3 weeks. Buy those canned goods. It's not because, hey, death is at your door, you're going to die if you go outside for a walk. It's no, you might be contagious and not know it, so let's be safe. Time for a Netflix binge for a couple of weeks, right? It doesn't sound so bad if you couch it the right way.
Exactly, Tim, and I just wanted to add that, right now, Central Connecticut, knock on wood, we don't have any documented cases.
Yeah,
so
none.
We're not an area of outbreak. Really, the biggest, as a healthcare provider, the biggest things that we look at are your exposure risk. Have you just come back from Westchester County? Have you been in contact with someone who has coronavirus? Have you come back from a trip from Northern Italy? Right now, in terms of where we are in Hartford County, those, you really need some sort of significant risk plus clinical symptoms for us to use testing. And the reason is that, and it's not because we just don't want to do the test. The reason being is that we're extraordinarily limited on who we test. I think, you look at South Korea and where they do the drive-through screenings of whoever wants to be tested can be tested. Unfortunately, we don't have the resources to do that now. I think at this point we're using a lot of, we're using the state lab. And as many of you know, the state lab has a limited resource of how many tests they can even perform.
They're trying to get up to 60 a day.
Exactly.
And that's fine for now, I think. But if this spreads the way it's projected to, that will be insufficient pretty quickly.
Right. And what I see happening is, we've seen in the last few days more private labs come online, but even that has its limitations because these private, private labs are not across the country. We may end up having to send samples to the West Coast. But what I hope to see and what I believe will happen is that more private labs will come online. The test will be able to be performed in-house, much like how we're doing the flu swab in-house, and we'll be able to get results within a few minutes. I think that's how things are evolving, but we're not there yet.
Yeah, and that's causing a lot of frustration. We've gotten some emails in from people saying, how come I'm refused to test for the coronavirus? My husband, he's been sick for 2 weeks. He hasn't had a fever, but he's had this, and this. And the first thing I'm thinking is, well, for both the flu and coronavirus, I think fever is the single most common symptom. So if you have to make these tough choices like doctors do as to whom to test, well, maybe having a fever, it's no guarantee, but now you can at least understand why they might have refused the test.
Yeah, and I just wanted to add, Tim, that the utility in seeing your primary care doctor when you have an upper respiratory infection is that many times we can help diagnose an alternative diagnosis. We know that if you have the flu, you got the flu.
Yep.
It's not coronavirus. You know, we can make a definitive diagnosis, then there really is no need for alternative testing.
So at what point should somebody who's feeling a little run down and maybe running a low-grade fever say, all right, let's go figure out what's going on?
Right. I think if you've had, and this is kind of a gray area, I think if you've had a concerning exposure, you should really reach out to your primary care doctor. So, but that, the CDC guidelines say, travel to an area of outbreak or exposure to someone with coronavirus. But the first part, the travel to an area of outbreak, is changing on an hourly basis, right? So now, now we can include our neighbors in New York or neighbors in Massachusetts and Rhode Island. It used to be Wuhan, China. It used to be Northern Italy, but that's changing so quickly. So it's kind of a moving target. I would say that each is a case by case basis. If you work in a large corporation where international travel is part of the job, you don't know if your colleague has traveled to a certain place in the world. Who has been a great resource is also the local health department. I can speak about locally in Bristol. Our local health department has been fantastic about fielding phone calls, not only from healthcare providers, but also from the community. And you can call them, and you can speak to a nurse about your risk factors, and they can help guide you as to whether you need to be tested. In that situation where you need to be tested, that allows the hospital kind of heads up to prepare that, hey, John Smith is coming in and he's going to need a test. That allows us time to kind of prepare a special room to be able to receive you. And it's really a coordinated effort. Then once you hit the door, there's no question. We kind of know that you have been screened and the test is appropriate. So it makes our job a lot easier and makes it for I'm sure a better experience for the patient as well too.
Yeah, I know we probably have to wrap this up sooner or later. You've been so generous with your time. I do want to ask on a personal note, because the virus is evolving and growing so quickly, the response to it here in Connecticut has happened very quickly over the past couple of days. It seems like a lot of people, a lot more than I thought, have caught on to the hand washing. Let's get the wipes out. Let's cancel some events. Again, I'm not saying everyone might be justified or a little premature. I'm just saying the awareness seems to have blossomed along with, just as virally as the disease has in some places of the world. Has it surprised you how quickly things are starting to move?
In some regards, no. I think I think as a medical community, I think people are motivated. I like the point that you brought up before that in a situation where which can generate fear and anxiety, really the best thing you can do is plan, do something,
Yep.
and learn more, right? Become educated, get credible information, and just and plan for the kind of worst case scenario, right? So you plan for the worst and hope for the best.
Yeah, they always say plan for the worst and hope for the best, and they're right. But it is this situation where planning for the worst makes you be forced to confront what the worst could be, and it's absolutely terrifying. We don't talk about it much because it hasn't happened yet. At this point, it's speculation, but think about it. There's 1,000 cases in the U.S. If it's doubling every 4 days, you get to 2,000, 4,000, 8, 16, 32, 64, 128, 256, 500, and 1 million. You can get to 1 million cases in 40 days. I mean, that's just throwing out, I think they're saying maybe 6 days at point. So you stop it right in its path. You do the things we're doing now and that the government is telling you to do. Oh my goodness, it's like we could be superheroes. It's a little far, but you get the idea. Going out and doing something is very, very empowering, and it will help to fight that sort of anxiety or ennui that can come with thinking that, oh God, here we go, we're going to get overrun. It's going to be the swine flu all over again, but worse, So there's a lot there to like. There's a lot there to do. One other thing, I always want to mention this. I think we still have on our website, the Environmental Protection Association has released a list of products that are approved to kill this new coronavirus. And while a lot of people are focusing on wipes, there are more products than just wipes. The standard yellow can Lysol spray that says it kills 99.9%, that's on the list. So when you go to the store and the wipes are all out, sometimes some other equally effective products are sitting right next to it. Nobody's touching them because they've got Clorox wipes on the brain. So get to that list. go out, buy some of those things, just be more vigilant about cleaning. You'll be surprised how much better you feel because we're all doing this together. This is like the best of America. There was always this good romanticized image of America that, you know, when times were tough, we came together, we worked for the public good. That's what we're doing right now.
Absolutely.
It's going to be a very good feeling. Any last thoughts? Any last comments? I'm done with my spiel. I got off my soapbox, Doctor.
No, I mean, just, you know, I think for the communities, you know, it's important to keep in mind just the basic stuff, you know.
Yeah.
I get so many questions about what you can do or what we can do to help prevent spread or help prevent getting the virus. And it's nothing novel, you know, it's just a simple hygiene things that you can do. And just be respectful that, you know, when things are canceled or events are canceled, it's canceled for a pretty good reason. So, but I think, you know, I think that message has been put out there, and I think it's pretty clear to the public what we need to do as a community.
Yeah, get it out there. Don't be overly worried when you start to see the numbers go up. That's the reality we're at right now. I know we keep saying only 2 cases in Connecticut. It's true, but that doesn't mean you should be panicking when 2 turns into 4, turns into 8, and turns into 16. It's okay. Do what you can. You flatten that curve. You slow the spread down. It's going to make a gigantic difference for all of us. All right, we're going to probably do a lot more of these Facebook Live videos in the coming days and weeks and months to keep everybody educated. So keep those comments coming in. Keep the questions coming in. I'm going to monitor the comments section of this Facebook Live video as well as the coming hours and days come. I'll do the best I can. I'm no expert, but the best part about my job is I have access to experts like Dr. Lim. Thank you so much.
All right,
for
thank
joining
you.
us. Elbow bump it?
Yeah,
There
sounds
you go.
good.
All right, have a great day.